Good morning, everyone. I am Ravi Gupta, editor-in-chief of eHealth magazine, and it's a pleasure to welcome you all. I will take the pleasure of inviting the eminent dignitaries on the dais. Shri Kesav Desi Rajuji, who is Additional Secretary, Ministry of Health and Family Welfare, sir, kindly come on stage. I will request our President, Dr. Narayanan, to kindly bring him here. Dr. Ajay Kumar Singla, who is the Additional Secretary, Health and Family Welfare, Government of NCT of Delhi, and CEO of Aapka Swasth Bima Yojana, sir, kindly come on the stage. Dr. Ashok Kumar, who is a Director of Central Bureau of Health Investigation and Deputy DG of Central Health Services, Government of India. Kindly come on the stage, sir. And we have Amod Kumar, who is the Project Director of MNH, Intra Health. Kindly come on the stage. And I will request my colleague Ankita to kindly present a welcome bouquet to our dignitaries. Kindly. So, before we proceed, I will like to give a very brief intro about our organization. And eHealth is a monthly magazine on healthcare ICT, medical technologies and applications. Very short and simple description of ours. We have a website called ehealthonline.org. Some of our previous issues of our magazine, and we have focused on creating a platform for stakeholders in the health sector through newsletters and a portal, and also a monthly print magazine for last 4 years now. And today we have the opportunity to launch actually 50th issue of our magazine. And it's been a very interesting journey, and we have been like documenting case studies, research papers, policy briefs, expert articles, executive interviews, industry trends and market updates pertaining to healthcare, ICT and medical technology industry. And before I proceed there, as we are all aware in the health care sector that the per capita spending on health care by our general public, common managed very, very high. In fact, today is like one newspaper report I was reading on the way here to the hotel that more than 50% of our population goes into what you call financial distress because of the health expenses. And healthcare expense is one of the highest expenses of any common man in India. And and more than 80% of our healthcare needs are being fulfilled by the private sector. And so there is a need for creating much more awareness about opportunities for developing the health sector and like increasing its impact on the general progress of the society. And that was the broader aim and agenda with which the eHealth magazine started. A brief background about our organization, eLet's Techno Media. We have taken upon ourselves 3 focus areas, which is governance, health, and education, as focus areas for creating awareness about ICTs. And our magazine called eGov is again Asia's first and only monthly magazine on e-government. And our magazine on digital learning is again focusing on ICT in education, both skill and higher education, and school education sector. How can IT play a role? And our three important portals: eHealthOnline.org, eGovOnline.net, and digitallearning.in. And all these portals have archives of all our previous issues, and all are being updated daily, and all have a global readership and a global outlook, although being focused on the local issues. And our flagship event is called E-India, which is the largest ICT event of India. Like it's in the seventh year now. And eHealth India is a large event, 3-day event, which happens as a part of eIndia annually. We also have an event called eAsia, which I've been doing since last 5 years. And again, which has a Asian focus on the health care issues, and we get the Asian healthcare leaders to talk about ICT in health. This, like you are seeing the photo of last year's inauguration, which the president of Sri Lanka inaugurated at Colombo. And before I will proceed, I will also give a outlook on some of the previous the journey of the 50 issues of eHealth. And this was our annual special issue in 2008. Just to give you a glimpse on what are the topics we have been covering: medical devices, healthcare networks, devices like regulatory authorities, the investments from the VCs, and excellence in IT implementation, in telemedicine, clinical research. We did IT and hospital survey in 2008 for various regions, and our healthcare in India reports. So various dimensions of the health care industry we have been covering in our magazine. And the response, I will say, that has been amazing. The healthcare community needs a platform like this. It has been a clear need, we can see that. And I will now request my colleague Ankita to give a copy of the latest issue of our magazine to all the dignitaries here. And I will request the panel to open and launch the 50th issue of the magazine. So. Yeah. I will now request our President, Dr. Narayanan, to come on the stage and give a welcome speech to all of you. And then we will have our chief guest, Dr. Desi Raju, to speak. So.